Imagine yourself when you're about to leave your house and it takes you an hour or two to leave because you have to go back and see if you have turned your appliances off or locked the doors. Or performing hand washing for more than 30 times because you're terrified of contamination by germs or viruses. These are just some of examples or struggles of an individual that have obsessive compulsive disorder. Having the knowledge about OCD is important because it also affects family and personal relationships. By researching this topic, I was enlightened about this disorder. OCD can also affect children and adults. Tonight, I will define what OCD is, the different symptoms and behaviors of individuals who has it, and the means of treatment will also be discussed for you to be able to develop a greater understanding about the disorder. What is obsessive compulsive disorder? Obsessive compulsive disorder, which according to Jim Keogh, an author of Psychiatric and Mental Health Nursing, Demystified, is an anxiety disorder characterized by obsessions and or compulsions. Obsessions are persistent, unwanted thoughts, ideas, or urges that intrude into a person's thinkings and cause excessive anxiety or worry. Compulsions are mental acts or behaviors performed repetitively to relieve or prevent the anxiety or worry generated by the obsession. In the United States, OCD is considered the fourth most common psychiatric diagnosis. In the United States, about 1.2% of Americans have OCD. And among women, slightly more women than men are affected. It often begins in childhood, adolescence, and early adulthood. Obsession symptoms. OCD can also manifest in a wide variety of ways. Typical obsession symptoms include contamination obsessions, unwanted sexual or aggressive thoughts, and the need for symmetry. Compulsion symptoms include checking, cleaning, and washing compulsions. These behaviors are time-consuming, distressing, and interfere with normal routines and relationships. Individuals who have OCD, which according to Wanda Moore, author of Psychiatric Mental Health Nursing, have traits that are inflexible and maladaptive and cause either significant functional impairment and subjective distress. People with OCD don't gain satisfaction from doing their compulsions. They often have the intention of preventing or avoiding dreadful situations such as illness or death. The journey of recovery from obsessive compulsive disorder begins with an accurate diagnosis. Recognizing these symptoms can help the person with OCD come out and seek treatment. How is obsessive compulsive disorder treated? According to the American Psychiatric Association, it is stated that cognitive behavioral therapy, which includes exposure response prevention, helps by giving the individual with this disorder by giving tools and techniques that will help to manage their obsessions. Medications are also effective in treating the symptoms of an individual with this disorder. Medications can reduce anxiety levels, making it easier to implement cognitive behavioral therapy techniques and tools. When used together, most people with this disorder experience the greatest benefits of the treatment. Now that I have informed you about obsessive compulsive disorder, I will lead you to my conclusion. Tonight, I have discussed the general information on obsessive compulsive disorder. The symptoms of this disorder can interfere in all aspects of an individual's life. There are effective treatments that an individual with obsessive compulsive disorder may benefit. I hope that tonight I was able to fill your mind with a clear understanding about the disorder.